Assalamu alaikum.
Waalaikumsalam.
How are you? Welcome back. Are you okay? All are okay, alhamdulillah. Are you healthy?
Yeah, inshallah, we are all healthy.
Okay, so let us start by al-Kitab, al-Fatiha. Okay, for group 2, who will be the one to present first?
It's going to be me, doctor.
Okay, good. Go ahead, Faiz.
Okay. I
And
will be
your
the
group.
doctor,
Okay,
and Shamina will be the role player. It will be the patient, mother.
very good. Okay, who will do the Oski?
Me, Dr. Afrina.
You have 15 minutes, please. And all needs to mute their microphone, please.
Okay. Bismillahirrahmanirrahim. Good afternoon, madam.
Good afternoon, doctor.
Madam, my name is Faiz, a medical student from IIUM. And I'm here today. I want to ask a simple question regarding your child. Is it okay with you, madam?
Yeah, no problem.
Okay, wonderful. Okay, madam, can I know what is the name of your child, madam?
His name Weihan.
Currently, how many old? What is his age currently, madam?
Oh, 10 months old.
Okay, 10 months. Okay. So, madam, can I know exactly why do you bring Weihan to here, madam?
Oh, actually, I noticed he had rashes over his body and it get worse. That's why my husband and I come here, bring him to the hospital because we get worried about
Okay.
him.
Oh, you worry about the rashes
Yes.
found in Weihan. Madam, can you elaborate more on? Can you explain more how does it form? The rashes is left.
Okay.
Explain more.
I noticed the rash happens at the palm first, and then it goes to the hands. Later on, it goes to the legs, to the sole, and when I change the diapers, I can see some of the rashes at the buttock also. And there is also some rashes at the mouth, around the mouth.
Oh, can you when exactly does it when, madam, does it occur, the rashes?
About 2 days before we come to the hospital.
Can you describe the rash itself, madam? Describe the rash, the
How can
characteristic.
I?
Does it form like, is there any reddish discoloration on the skin?
Oh, I see small red spots on hands, on the rashes.
Do you notice any form of fluid come out from the rashes?
No.
No fluid. Do you notice that there any sign of itchiness? The baby start to express itself? Any?
He scratched over the rashes.
Do you notice that the baby doesn't like anyone to touch his the rashes because maybe due to pain? Do you notice any of that?
Oh no.
Oh,
Okay.
no.
Yes, okay.
Oh, another thing, do you notice during is any ulcer form on his mouth, inside his mouth, madam?
I'm not sure about that.
Or is there any whitish spot noted inside the mouth?
I also don't notice that.
Okay. Do you take any vaccine? Follow the vaccine from Kementerian Kesihatan, madam?
Yes, we follow the
Okay.
vaccination schedule.
And based on the vaccine, during Wehan is currently 10 months. Supposedly during his 9 months, he's supposed to have a MMR vaccine. Do you take it, madam?
Yes, we take it.
Oh, okay, thank you. Do you notice any redness on his eye? Noted.
No.
No, okay. Another thing, madam, aside from his rashes, madam, did you anything that you want to share that you are currently worried about? So, is there any fever,
He
madam?
also he had fever.
Oh,
On the same day he had rashes.
can you elaborate more on the fever, madam?
On the same day he had rashes, 2 days also before we go to the hospital. What else you want to know?
Maybe is there any runny nose? Do you notice any cough?
There is no runny nose, but he had also cough.
Or was the cough? Is there any sputum noted cough?
I can hear like there is something stuck in his throat.
Oh, is there something stuck in his throat?
Mm-mm.
Is there does Wehan and do you notice Wehan started to reduce any oral intake, reduce in hasn't the appetite to eat, to drink? Do you notice?
He does it like usual.
Oh. Okay, do you notice does he have any problem in his, do he have a tummy ache, he has diarrhea, vomiting?
He had vomiting once.
Or once?
Mm-mm.
Can you explain more the vomit of the vomiters? What is the content?
He vomit milk and also the foods that he already eat before that.
Okay, only one episode only.
Only one episode.
Madam, do you take Wehan to any nursery?
No, I take care of him at home.
Oh, take care of. So you never went to any crowded spaces, madam?
No.
Recent history of any crowded places? Is it
What?
recent travel to any crowded spaces? No.
Oh no.
That's is he the only child, madam?
He's the only child.
Oh, okay. Do you have any? Do you or your husband have asthma, have eczema,
No,
allergic
he
rhinitis?
doesn't.
No. Okay, madam. Madam, is this his first time admitted to this ward, madam?
It is actually the third time he
the
was
third.
admitted to hospital.
His first admission was due to what, madam?
It is due to pneumonia, if I'm not mistaken. At that time, he was only 2 weeks old.
Oh, okay. For his second admission, due to what reason, madam?
It is 2 months ago, due to chickenpox.
Oh, chickenpox.
Mm-hmm.
Okay. For drug, he has any underlying illness, madam, such as newly diagnosed asthma, eczema? No.
No.
Okay, no underlying illness. Thank you. Does he take any drug, madam, or any allergic to any sort of medication?
No.
No. Okay. For immunization, you follow the schedule from KKM. Okay. Do you have any during his delivery process, madam? Do you have any problem throughout your pregnancy? For example, you have diabetes, hypertension?
No.
Oh, no. And during the delivery, can I know what form of method that you deliver Wehan?
The doctor need to use vacuum at that time.
Oh, vacuum. Is it because exhaustion, madam? Because it's your first child.
I think so. I don't know.
Okay. After delivery, is there any problem? Any bleeding?
No.
Okay.
No problem.
For his development, is there anything noticeable that you are worrying for the development?
No.
No.
Everything is okay.
Okay. Nutrition, can I know, do you currently exclusive breastfeeding? Or you
We
started,
start,
carry on, miss.
He
Carry on, madam.
he start on formula milk when he was 1 month old. And currently he drinks about 30 ml, about 3 times per day.
Okay, thank you, madam. Is he a picky eater?
He likes to eat fruits but doesn't like to eat vegetables.
Okay, thank you, madam. So can I know so you work as a housewife. How about your husband? What does he work as?
My husband work as technician, electrician.
Electrician. Okay. Does any of you have any illness, diabetes, heart
No,
diseases? No.
no.
Okay. Can I know where do you live? Where do you live currently?
We live at Taman Tiram Aman.
Oh, Taman Tirama. So in the house, how many of you are there? Only you three. Your husband, you, and also your child.
I live with my mother and also my mother-in-law also.
Oh, okay. Does also any of your family members also have the same city of Wuhan? Any rashes noted?
Oh, no.
Okay, thank you. So, do you have adequate necessity, clean water, electrical supply?
Everything was good.
Okay, Alhamdulillah, thank you. I think that's all from me, madam. Thank you so much.
Okay, thank you.
Not all from you. To give a summary.
Okay, for the summary, Wei Han, 10 months old Chinese boy, presented with generalized itchy of the rash, which at his palm, at his sole, leg, and also around his mouth. He is also associated with fever, chest cough, and reduced oral intake.
Okay, so what's your working diagnosis?
My provisional diagnosis is hand, foot, mouth disease.
Why?
HFMD.
Why?
Because due to his fever and also his rashes, which initially formed at the palm, sole, at the feet, and based on his mouth, hand, foot, and mouth diseases. So maybe I can also take note that maybe due to these diseases, because due to the description of the rash itself.
What's your differential diagnosis?
For my differential diagnosis is scabies, because the description of the rash.
Yeah, you didn't need to read, please. Now the knowledge in the brain, not in the book.
Okay.
So what is the differential diagnosis?
That is the scabies. First of all, scabies because complaint of itchiness, and also the description of the rash also propose scabies. Another differential is measles, because of the formation of the rash, and because due to rash and fever. However, it's less likely because he also underwent a vaccination, MMR vaccine, and also there's not noted any form of puppy spot. For my other differential is varicella zoster infection due to fever, rash. However, again, it is less likely because he has previous history of chickenpox. And also, the rash itself does not suggest varicella because it's maculopapular rash. It's not vesicular. There's no fluid noted around the rash.
Okay, so how can we diagnose that one? Confirmation.
For the varicella, Doctor?
No. For
The
the hand, foot,
HFMD.
mouth, yes.
Well, for the confirmation is basically mostly clinically. This does not require any form of lab investigation, because based on the history, is there any sore throat? For in this case, in this patient, he has reduction of oral intake. He doesn't want to eat, and also the rash, the rash, we suggest that it can have FMD.
So I am asking you now for my baby. I need you to confirm that. How can you confirm by investigation?
Or for the investigation, we can use PCR to detect for any evidence of Coxsackie virus infection.
Do you mean PCR from where?
The blood, doctor.
The blood. So what is the causative organism phase?
The causative organism is from the enterovirus. The common one is Coxsackie virus A16.
What is the difference between them?
I'm sorry, the difference between what, doctor?
What is the difference between them? And it can be one of these two viruses, Entero or Coxsackie 16. Is there any difference in if my child got the Entero or Coxsackie virus?
Oh, it's more on the complication, because the Coxsackie, the manifestation is mild symptom. However, Entero, I think there's a morbidly complications such as encephalitis, I think. If I'm not mistaken.
So what is the complication which we can get? My child susceptible to any complication?
Yes. For example, dehydration, because the dehydration because doesn't want to eat to drink more, and also if the virus go to the bloodstream, can cause meningitis or worse, encephalitis.
What else? A common complication?
Example, if the patient scratch, it can cause Staph aureus infection.
The secondary bacterial, okay, mainly by Staph aureus. Okay, how can this virus come to my baby? Do you know?
Because it can due to water droplet from if the patient cough, it can also transmit it through that, or via fecal oral.
So direct contact, but sometimes it can be affected by the other, but usually it needs direct contact from the saliva of the patient, from skin, hand, foot, mouth. These are very important. Okay. Can we go for your slides?
And this is the chief complaint. Pressures for 2-day duration. This is the finding. And so this is the provisional diagnosis.
Okay.
The hand, foot, mouth disease, which I already explained. And this is the differential scabies, measles, varicella.
Your colleague, what's her name? The mother.
Shamina.
Yes, doctor.
Shamina, what is the most important point to diagnose scabies?
The clinical, the chief complaint usually due to itchiness.
Okay, so anyone with eczema can be scabies?
Doctor, can I help, doctor?
Give her a chance. Plus, you got your marks already. I have 23 candidates now. Anyone? Phase.
because scabies very
Faiz, don't answer, Faiz. Sorry. Afik Nasser.
Yes, doctor.
Is there any important clinical signs will help you
So
to diagnose
for
scabies?
so mostly the rash is mostly located at the hands or foot, and the scabies, the rash is pruritic in nature. And it's also maculopapular. Also, the rash, the itchiness also happens usually at night.
So if we add for with Afika, any something basognomonic, Afika,
Which Africa, doctor? Is it me or the Nur Africa? We have
Nasser,
two Africa.
Afika, Athira, Afika, Nasser, Afika
Yes.
Nasser.
Afiq Nasir.
Mm,
Afiq.
yes,
Yes.
Afik Nasser. Okay. No, I was thinking about Afika Athira. I'm trying to
Like
read
okay.
Athira. Hmm.
So how we diagnose scabies?
Clinically.
Mm,
Okay, so all of you have, I think, a presentation of skin problem, but you must read it. Don't wait for that. Okay, it is very important to look at the webs. If you find in the webs of the hand skin lesion, this is pathognomonic for scabies. Okay, of course, it will affect in the will build the skin, the soft area like the abdomen and the flexure area. But in infants up to 2 years, it can affect all the body. Okay, so you must read about that. So then I will ask from this a good series of name. Afik Nasser has opened the twice. Okay, I don't know. Afik Nasser, anything pathognomonic for measles?
Pathognomonic for measles, betul.
Yes.
Pathognomonic for measles is ni apa tu? The presence of complete spots in the mucous membrane in the mouth, but however it's quite difficult to find the complete measles because it happens before the start of the rash.
Yes, but what does it look like?
Whitish in color inside the mouth.
With a red base. It is very important if the patient has fever and start to have the early manifestation. If you pick it, it is pathognomonic. Another thing for the measles is also it will start from up. Okay, and they said it looks like a curtain. It will start, and when it start up, it will go down until disappear from down. Okay, it is very, very important. For varicella, for varicella,
For varicella, it's pruritic vascular rash. It's very it's pruritic in nature.
okay. What's your opinion, Ifat? Fat,
Yes, doctor.
varicella. Any something specific will guide you?
Regarding the rash, is it?
Of course.
Um,
There is one word specific for it also. We said here, if we found in the web of the hand, it is diagnostic. We said the missile, it will complex and will start from now, from head and come down, 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 down. When it came down, the upper part of the body is improving. What is for this very cell? There is an important word. If you didn't notice it, which is centripetal. What is the meaning of centripetal?
Can I try, doctor?
Centripetal.
Is that the rashes is progressive in nature, where it will start from macule and papule, and then it becomes pustule, and in some period of time it will be like scab when it is recovered.
You are true. This is another point which is a correct and important point also. But I mean by the centripetal, most of the rash will appear in the central area, in the abdomen and the chest and like that. That's why many times it didn't diagnose, and it will be few in the face. Of course, there is difference between patients. There is one patient can go to 1,000 vesicle and one got 5, and the 5 may be in the abdomen, and the mother said, oh, it may be some urticaria. Okay, forget it, and forget it for a few days, it can disappear. That's why many cases are not diagnosed. So it is a centripetal, okay, and it will appear in groups. It will not come as one group. No, it will one after 2 days another group, after 2 days another group. So it will go about 3 groups. Okay. So this is important why you are trying to concentrate in diseases. It is the same. How can I know phase from a fig, from ifat, from shinina? I must be able to differentiate. Okay, it's very important. Okay, continue. Continue phase.
And maybe we can proceed with the skill,
Okay.
doctor.
Sorry. Okay.
Okay, so I'll be taking over for the OSCE. So for this case, we'll have 2 OSCE questions. So this is the first one. So for this question, a child came with itchy rash. All siblings in the house presented with the same symptoms. So from this question itself, you're given 3 information. So 1, the itchy rash. Number 2 is all siblings presented with the same symptoms. So you're thinking of something contagious. And then the third info is basically the picture itself. So you can see the characteristic of the rash. Okay. Anyone would like to answer the first question? What is the most likely diagnosis?
You can choose. If no one raises his hand, you can choose without permission from me.
Okay, I'll choose randomly. Okay, how about Musawa?
Okay, so from the picture, and because all siblings in the house presented with the same symptoms, so I think this rash is looks like something like is it scabies?
Scabies, okay.
Is it scabies? I'm not very sure. I'm just tembak-tembak.
Okay, good. So if scabies, then proceed with the next question. What is the causative organism if you're thinking of scabies? Musawa?
SS.
Oh, it's me also. Okay. So scabies. Usually, scabies, not usually lah. Scabies, the causative organism. It's wait. Let me Sarcoptes scabiei, right?
Sarcoptes scabiei. Okay.
Yeah.
Okay. All right. So okay. So can we proceed to the next slide? And then let me just answer the third question. Okay. So in this case, itchy rash, we're thinking of something with pruritic lesion. and the fact that it's contagious, and with thinking of the characteristic that is pictured in the picture. So the most likely diagnosis in this case is scabies, just as Musawa has answered, and the causative organism is Cercoptes scabii. For the differential diagnosis, we can list down diagnoses that came with similar manifestations. So you can list down atopic dermatitis, eczema, which comes with pruritic lesion as well. The only thing is, in this case, it's all siblings in the house presented with the same symptom, right? So we're thinking of something contagious, whereas eczema is more of a skin irritation rather than a mite infestation or infection. So the worst case scenario is probably every sibling has eczema or something. I don't know, that will probably happen. But
you must remember that the itching is more at night.
At
night time. Okay.
Okay.
Go for the second OSCE.
All right. So the next OSCE. So
Yes.
1-year-old child presented with rash and fever. There is a same lesion on his mouth and feet, and then you have that picture. So you have that information of the symptoms, and then you know the lesion is on his mouth and feet, and then you have that picture as well. So what is the most likely diagnosis? So I would like to ask Nabiha Farhana.
Yes.
Okay.
The child presented with rash and also fever, and also the lesion is on his mouth and face. So I think the most likely diagnosis is hand, foot, mouth disease.
Okay, good. Okay. All right, thank you, Nabiha Farhana. Okay, so for the next two questions, actually we've already discussed it with Dr. just now. Okay, so next slide. Okay, so the most likely diagnosis in this case is HFMD, hand, foot, mouth disease, although this is actually very superficial of a symptom, but they give us the hint, whereas the same lesion is on his mouth and feet. So this is, with this information, we think of HFMD as the most likely diagnosis. And then for the etiology, when we're thinking of HFMD, we think of two most important etiologies, which is Coxsackie virus A16 and enterovirus 71. However, in the case of Coxsackie virus A16, it is the most common etiology, but of importance of the etiology that we fear of, the one that gives more severe outcome, which could lead to neurological involvement such as meningitis, encephalitis, and all that, is enterovirus 71. So is EV71. So remember these two important etiologies when it comes to HFMD. So I think that is for OSCE for this case.
Okay, an important differential diagnosis which you must notice, which is Stevens-Johnson syndrome. I need you and Face to do some slide about erythema multiformis and Stevens-Johnson syndrome. It's very important, and it can be a complication from many cases, and it can get a rash in the skin and the mucous membrane if we have more than two skin membrane, like in the mouth, in the eye, in the genitalia, like that are very important. Okay, so you need to prepare 2 slides about Stevens-Johnson syndrome. Okay. And you must put it in the differential diagnosis. And you put what is the differential diagnosis of the target lesion. What is the target lesion? And what is its differential diagnosis? Okay. And when you finish, you need to send it to me. Okay. Don't forget pathognomonic for measles, pathognomonic for chicken, pathognomonic point. Just remember, because it is a landmark for you during your examining of the patient. Okay, can we go for the second case?
Yeah, Assalamualaikum. I'm going to present the second case. I'm going to be the doctor, and Naziha is going to be the patient.
So Anis Shafika is doctor?
Yeah.
Okay. ahead.
Okay. Assalamualaikum. Good afternoon, ma'am. May I know your name?
Waalaikumsalam. My name is Puan Salma.
Okay, so I shall call you Puan Salma. Is it okay?
Yeah, it's okay.
Okay. Can I know what brought you to the hospital today?
I came here because of my son's. Because of my son, he has a facial puffiness and leg swelling.
Oh, okay, I see. First of all, can I know his name and his age?
My son is Putra. He is 8 years old.
Okay. Thank you. Okay. For about his facial puffiness and leg swelling, for how long has it been happening?
It has been for 2 days durations.
Oh, okay. So you noticed it since 2 days ago. Is there? Did you notice puffiness around his eyes?
No, I did not notice any puffiness around his eyes.
What about at other parts of the body, like his testicles, or you notice any distended abdomen?
Also seems there is no other swelling part at other parts.
Oh, okay, I see. So is this the first time that you notice he has puffiness and swelling?
Yes, the first time.
Okay, okay, I see. So before the swelling started, was your son healthy, or was your son okay, or is there anything that happened?
He has no problems except that he presented with ear discharge a week ago when after he went to the swimming pool.
Oh, okay. So can you describe the ear discharge? In the color.
First is when I noticed the discharge, it's clear. However, later on, it turns into the pus, like the pus.
Oh, okay, I see. So did he complain of it being painful?
No, he doesn't complain any pain.
No. Did he have any fever? I mean, do you feel his body feeling warm or something?
No, he has no fever.
Okay. What about did he have any sore throat, coughing, or runny nose?
No, none of that.
No. Okay, I see. Okay. And is there any changes in his urination?
Yeah, the color of the urine is changed because it turns dirty color and somehow it looks like cloudy in color. Cloudy, it's like cloudy.
Oh, okay, I see. So, when did you start to notice this? Is it same as the puffiness?
Yeah,
The
if I'm not
swelling?
mistaken, yes. Seems.
Okay. Okay. Did he complain of having painful urination?
No.
No. So the urine just now looks cloudy, right? But
Yeah.
is there? Did you notice any like foam or like little bubbles in the urine?
No, it's just cloudy.
Okay. So did he go to the go to the toilet more often? Like he needs to any urgency to the toilet?
No urgency to the toilet. However, the frequency of he went to urinate is reduced.
Oh, okay, I see. Is there any problem with his bowel movement?
No, I don't think so.
No. Okay, so just the urination problem. Okay.
Yeah.
Is there any other associated symptoms that he present? For example, like rash.
He doesn't have any rash, but he presented with skin lesion at his legs.
At which part of the leg exactly?
If I'm not mistaken, it's at the both of his ankles and shins.
Oh, okay. So both of his legs, right?
Yeah.
Okay. So when did you notice this skin lesion first?
When I first start notice is 3 days before he presented with the chief complaint just now with facial puffiness and leg swelling.
Oh, okay. Okay, I see. So can you describe the skin lesion to me? How does it look like?
It somehow looks like it has pus and also crusted looking.
Oh, okay, I see. Is there any other part of the body that present with the same lesion?
No.
No, okay. So did he complain of being painful or itchy, the skin lesion?
Yeah, it's painful and itchy.
Oh, okay. So is there any other family members in the house that present with the same symptom like him?
No, there is no family member have the same symptoms. However, my neighbor's children did have the same symptoms like him.
Oh, okay. So, okay. So did he complain of feeling any pain in his body?
No, there is
Like
no any.
abdominal tummy pain, like a back
Um,
pain? No?
No, no,
No.
no.
Okay. Okay. So did you notice him being tired, feeling tired easily, lethargic?
Yeah, I could say he was lethargic somehow recently.
Okay. What about his appetite? Can he still eat well?
His appetite is reduced, but
Okay.
no
What
loss
about,
of
is
weight.
there any loss of weight?
No.
No loss of weight. Okay. No loss of, okay. So because of all these problems with him, did you seek any medical attention before coming here?
I do apply a medication that I bought from the pharmacy on the skin lesion, but somehow it did not resolve. So after I noticed the swelling, I brought him to the hospital Jengke, and some tests were done to check his blood and urine.
Oh, okay. Do you know the result of the test or?
No, I'm not sure.
No, okay. So so at hospital Jengke, where he was given with any medication or treatment?
Yeah, he was injected with antibiotic and given tablet Adalat. I'm not sure what is that. And the doctor then suggests us to be referred to the Hosh house to refer here.
Okay, I see. Okay. So I just wanna ask, did he complain of having any chest pain, or did you notice him having difficulty in breathing?
No.
No.
No chest pain.
Okay. So that. Okay. And then his bowel movement is okay, right? And then okay. Okay. So is this his first hospitalization?
No. Actually, this is the third time he was hospitalized.
Oh, do you remember his first and second? What is it due to?
If I'm not mistaken, the first hospitalization is when he was 1 year old because of anemia, and the doctor said that his iron was low. And then for the second hospitalization, he was diagnosed with bronchial asthma.
Oh, okay. So is he on any medication right now?
Yeah, for the asthma, the doctor gave him Ventolin, if I'm not mistaken, for the asthma attack.
Oh, okay. So when was the last attack? Asthma attack?
Last year.
Last year. Okay, I see. Does Putra take any supplement like vitamin, anything?
No, there is no other.
No. Is he allergic to any drugs or food?
No.
No, okay. So I want to ask a bit about during your pregnancy with Putra. Did you have any problem during the pregnancy?
Yeah, I was diagnosed with preeclampsia during pregnancy.
Oh, okay, I see. So, what about diabetes during your pregnancy? Diagnosed with diabetes? No. Okay.
I don't have any diabetes.
Okay. So how was Putra born? I mean, what method?
Via CSEC for at 35 weeks.
Oh, okay. So he was born early. I see. So do you remember his birth weight?
His birth weight is around, if I'm not mistaken, 1.65 kilogram.
Oh, okay. So since he was born early, was there any complication after delivery?
Yeah, he was admitted to the ICU for 12 days due to the prematurity and low birth weight.
Oh, okay, I see. Okay, I want to ask about his immunization. So did he complete all of his immunization according to
Yes.
KKM?
Yes, he complete all immunization
Okay,
according to the KKM.
okay, did he present with any side effects?
No, there's no side effect.
No. Okay. So was Putra breastfed when he was younger?
Yes, he was breastfed for up to 2 years.
Up to years, okay. Is it exclusively or he started weaning early?
He breastfed for 2 years, but he started weaning at 6 months old.
Oh, okay, understood. So what about his diet now? I mean, what does he eat now?
He enjoy eating rice and chicken or fish. However, he dislikes some kinds of vegetables. He usually eats 2 to 3 meals per day.
Okay, I see. So did you notice any like developmental problem while he is growing up?
No, my son is healthy.
No. Okay. So I want to ask a bit about you and your husband, if you don't mind. So how old are you when?
I'm 31.
What about your husband?
My husband is 38 years old.
Okay. So can I know are what are you working as and your husband?
I'm a housewife, fully housewife.
Okay. What about your husband?
My husband is a businessman.
Oh, okay, I see. So do both of you have any medical illness?
No, we don't.
No. Okay. So I'm sorry to ask, but do you or your husband smoke?
No, he's not smoker.
No. Okay, good. So how many children do you have, including Putra?
Currently, I have 3 children, and Putra has 2 sisters, and he is the second child.
Oh, okay, I see. So both of his sisters are healthy?
Yeah, both of them are healthy.
Yeah. Okay, I see. Okay. So may I know your household income?
It's around 3,000 per month.
Okay. Okay, I think that's all that I want to ask, Puan. So thank you. I will try my best to treat your son.
Okay, welcome.
Okay, so can you make revision for us? Just a simple summary in few sentences.
Okay. Putra, an 8 years old Malay boy with underlying bronchial asthma, was referred to hospital Sultan Haji Ahmad Shah due to facial and leg edema for 2 days. He presented with symptoms of acute nephritic syndrome, which are facial and leg edema, hematuria, and oliguria. He has a history of ear and skin infection a few days before the edema started. He was prescribed with IV antibiotic and tablet nifedipine, which is for hypertension at Hospital Jengker before being referred here. So the signs and symptoms of this patient are suggestive of post-streptococcal infection, acute glomerular nephritis.
With a background of bronchial asthma.
Yeah.
Yeah, usually in pediatrics, we are not like adult. Usually we have a very big problem list. But if the patient have something like that, just be a good presenter and said a known patient of bronchial asthma presented by nephritic syndrome, maybe secondary infection to the skin eczema or like that. It is the same if the patient has Down syndrome. You must tell us. Don't wait until the end of the exam and then mention that he is Down syndrome or like that. Okay. A known patient with diabetes, with Down, is like that, presented by. Okay. What's your differential diagnosis, Anis?
My differential diagnosis, first nephrotic syndrome, because he presented with edema, which is facial puffiness, and also bilateral leg swelling. However, there is no faulty urine that can indicate proteinuria, which is a characteristic of nephrotic syndrome. And then inoxazoline purpura. However, there is no evidence of the purpuric rash itself, even though it can present with facial puffiness, also leg swelling, and also hematuria. And then my third diagnosis is IgA nephropathy, because it can also present with similar symptoms, which are facial puffiness, leg swelling, and also hematuria. However, usually patient with IgA nephropathy precedes with upper respiratory tract infection symptoms like sore throat or coughing, and also they also usually present with abdominal pain, but this patient does not.
So what is the difference between glomerulonephritis and nephrotic and nephritic?
Nephritic is usually it involves it occurs because of inflammation of the glomerulus, and nephrotic is due to high level of protein in the urine, in the kidney.
So the poor area or poor country or poor town can get glomerulonephritis, which is inflammation of the kidney itself, glomeruli, by infection, like post-infection. Post-infectious can be streptococcal, can be some other bacteria, some viruses, even atypical microbe can cause also that one. But for the developed countries, we are not safe. They will get the IgA, which considered as autoimmune glomerulonephritis. Okay, the most important point is to get a look for the urine. So what is the difference in urine between nephrotic and the nephritic?
You mean in nephrotic there will be a significant proteinuria.
Okay.
But in nephritic there will be a hematuria, which is red blood cell in the urine, and can be a mild proteinuria.
Yes, but you mean hematuria, it means that the patient will pass blood in the urine?
Yeah,
red blood.
There will be red blood cells in the urine.
No, red blood cells is different. The color of the urine. Okay. I know that he has blood in the urine, but what is the color of the urine? It is bloody? I mean, as if the patient, by frank eyes, you can see it looks like bloody color?
It can look like dark tea color or Coca-Cola color.
Yes, so either tea or cola. So
like
is
brown.
it blood? Is it blood or not?
Yes, it's blood.
Okay, this is a very important point for all of you. Okay, if you found fresh blood, you must think about something else. I mean, acute cystitis, stone, tumor, like that. Okay, which is coming blood, the fresh blood, which we know, bilharzia, like that. But if you got the glomerulonephritis, the blood now, it will be, as your colleague said, it is dark color, cola, tea. Do you remember before when we are speaking about the gastrointestinal tract? If someone get fresh blood from the anus, we'll call that is fresh blood from the lower like piles, like cancer colon. If you got the dark blood, what is the name of that? Melina. It means it came from the upper GIT. Here also it is looks like from the upper it will come dark, but it is not to melina because it is hemoglobinuria. The red cells distracted, and now the hemoglobin is the thing which is giving us the color. So don't mix. And if you meet one patient with frank bloody, you must think other than glomerulonephritis. Okay, good. What did you think? This post-streptococcal glomerulonephritis need treatment or not?
Yes, need treatment. So for the infection, can give
for the
antibiotic.
infection. Okay. So if I am the father of the patient and asking you now, how is the prognosis for my child? His kidney will be destroyed?
Well, the prognosis is usually good, which is there will be 95% chance of cure for this disease. So you should not worry. So
I shouldn't worry. Okay, so I can go now. I am very happy that 95% of my child is okay. So no need to contact you because I'm very busy really.
Well, if he present with the same presentation again, then you should go to the hospital and check if it becomes a more chronic problem than just acute.
Anyone can help Anis? Or should I ask for the helper myself? Afrina.
Yes, doctor.
The same message directed from me to you. Did you agree with Anis, or you need to make modification?
I think, of course, the prognosis is good, but I would like to change a little bit the sentence structure.
Change, don't be afraid. Change.
Because
moderate to change, no issue.
because there may be like false misunderstanding that the son will be just fine. So perhaps say that the prognosis is usually good. Of course there is chance. How do I say it?
Risk.
So I will ask another Anis, Norian Anis. What is the complication of post-streptococcal glomerulonephritis? The question will appear more clear now.
From what I read, the complications of the acute glomerulonephritis might be acute kidney failure, chronic kidney disease, high blood pressure, and also nephrotic syndrome. So if I were the doctors, I will like keeps the treatment mandatory for the patient.
This is an important point for counseling of the patient. If I'm a patient and they tell me 95, I don't know what is the meaning of 95. 95 for my baby is okay, or 95 of the people affected, and my baby can get how much, and what is the complication expected? No, this is a very big difference, and I insisted to speak about that for you. If you tell any patient it is prognosis are very good, number one, anyone, because all of us, all of the patient are very busy, he will not come back because you told him it is very good. However, here are very important, or the but by English. أو معذرة يا mother or your father, there is an important notice in spite. If it is very good, you have an important notice. This small number, as Afarina said, it can affect the kidney, which can cause chronic renal problem. It can affect the blood pressure. And this hematuria will not disappear in one shot. It will still in the urine, but you cannot see. So the color will be improved, but still the disease is going. That's why you must stay with us at least 1 year. We'll see him until we're sure that the microscopic blood disappear, until his blood pressure is okay, until his kidney is okay. At that point, we will tell you we need extra time or we can discharge him. In spite of the prognosis are very good, because we are not pushing the responsibility of ourselves. We are begging the pardon of Allah subhanahu wa ta'ala that we are making the best care. Remember that during your practice of medicine, every patient is a test from Allah to you. Are you doing your job at the top, or you just making the lowest limit, or you are not keen to give your job your heart and dealing with other as if they are just عابر سبيل by Islam, and just one who will come and leave. What happened, what even happened for him, it doesn't mean anything for us. This is a very, 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 very short way to go to hell, not to Jannah. Okay, every patient now, from now and then, every patient you are dealing with him is a test for you. You will success in doing him the best care, so Allah will give you the best reward, or you didn't take care about some soft points. Because if this counseling, I think you have lecture for that, but it is very, very important. Okay, let's go for the OSCE now. Because he will close the clinic on me after a few minutes. Okay.
I will present the OSCE too.
Okay.
Okay. Okay. So this is the question. You can see there is a picture there of kidney biopsy. Also a picture of a boy with skin infection. Okay. So okay, I need to choose some. Okay. Can I get? Who's now to answer the question, the first question?
Okay, hello.
Yeah, sure.
Okay. Based on the picture, wait. Is most possible diagnosis is post-streptococcal glomerulonephritis because of the biopsy shows immune complex deposit in the capillary walls, and also because of the patient present with impetigo. If I'm not mistaken, the picture on the right.
Yes, you're right. Yes.
Yeah.
So the best is to say the diagnosis is post-infectious glomerulonephritis. Post-infectious. It is not autoimmune like IgA. It is post-infectious, and what is the possible organism is post-streptococcal. Okay. Continue the answering.
Yeah. Okay. So as Dr. said just now, the possible organism is Streptococcus, and usually group A Streptococcus. Okay, and then Can you tell me what are the two manifestations that this patient can present if with that diagnosis?
Me again. Okay.
Yeah.
To other
quickly.
possible manifestation like the previous case, most common presentation is facial puffiness, and then also dark colored urine. Hematuria.
Yes, that colored due to hematuria. Okay, I just want to add a little bit. For post-trap AGN, usually the way they describe the immunofluorescence microscopy is as lumpy, bumpy, due to the immune complex. And also for impetigo, it is it's a type of skin infection that is caused by streptococcus. It is usually described as a honey crusted lesion. As you can see, it's crusted, like dry looking, and also honey colored. So that's how they describe it. Yeah, okay, I think that is all for me.
Only this one? Okay, so now you lost the 0.5 mark now. For the first case, I need you to present how to examine the skin. Because all of you now may know how to examine heart, chest, abdomen, but Faiz will write a small article how to examine the skin. Okay? And how to comment about any skin lesion. Just present it to me first, because and after correction you can give it to the whole team. For you, you must make for us differential diagnosis of edema. Okay? How can what is the edema? How can I know the severity of the edema? Okay, what is the different causes? It is a very important. Okay? Mic clear? Because you must do some slides also about nephritis, about systemic lupus erythematosus, which is one of most common autoimmune disease which can cause post-problem nephrotic or nephritis. Okay, it is very important to consider all this one. I think this is the most important point which I need to stress about it with you. Now it's your turn to ask me. I will just switch off my laptop and I am with you on my phone to get your questions. Okay? You need to ask me any questions? Hello?
Doctor, actually, I do have one question. I read that nephritic syndrome have red blood cell cast. Is it one of the symptoms? And when I search in the internet, it said that red blood cell cast is can be found in the urine. So can I know what is the difference between red blood cell cast and also hematuria? Is it the same, or red blood cell cast is macroscopic?
No, this is different diagnostic.
Recording in progress. So red blood cell cast is macroscopic.
Yeah, it is. If you go through the urine. Okay, just a while. Because I opened the booth now. What happened? Can you hear me now?
Yes, we can.
Examination of the urine in case of nephrotic and the nephritis are very, very important because it will guide you to a lot of points, important points. As we said, you must know what is the type of castis. Castis means some sedimentation which will appear in the urine. Is this white cell castis, or is it red cell castis, or hyaline castis? There is a lot of series of this, which will help you to know the final diagnosis. So RBC cast also one of the pathognomonic. One of the pathognomonic one for the diagnosis. Closed already? No way? No way? Okay. What do you mean by giveaway? You push me? Okay, okay. Thank you. So the RBC casts are very pathognomonic for the glomerulonephritis also. That's why try for any disease you are dealing with it to know two things. Okay. Number one, what is pathognomonic, and what is the red flag? Red flag in that disease. I mean, some clinical manifestation or problem which will appear. I must stand up and take care because it may be complicated. I mean here, the red flag for the glomerulonephritis is what? Who can answer?
Hypertension.
Hypertension. Thank you. Very good. That's why the number one, when I see this color, I must run and measure the blood pressure. You know, many times we got a patient here which got severe encephalopathy. He came with convulsion to the emergency department, and when we see him, try to adjust it. When we measure, we found the blood pressure are very high. Just ask about the urine. They said they saw it changed. It looks like tea. So we come to the conclusion. This is hypertension or hypertensive encephalopathy. But do you know that what is the mechanism here? It is not like the mechanism of other brain hypertension here. Okay, it is now fluid overload. So if I treated the fluid overload, the blood pressure will be adjusted. That's why the input-output chart are very, very, very important. Can you hear me?
Yes, we can, doctor.
Hello?
Yes.
That's why, number one, what may be the red flag for us, and what is the pathognomonic thing which we can help for the diagnosis. And for every disease, you will find it very few points. But if you catch it, you will be very professional in defining the difference between diseases. Okay? Am I clear?
Yes,
Hello?
doctor, clear. Yeah, clear.
Is it clear for you?
Yeah, it's clear for me. Thank you, doctor.
Where is your voice? I cannot hear you.
Doctor, can you hear me now?
Oh. Okay. Any other question? See you inshallah again. And don't forget to send me the points which I referred to. Okay? سبحانك اللهم وبحمدك نشهد ان لا اله الا انت نستغفرك ونتوب اليك. See you in hospital soon. Feel healthy. Assalamu alaikum warahmatullah.
Assalamualaikum warahmatullahi wabarakatuh.
Thank you, doctor.
Thank you, doctor.